The mental disorder I chose as my topic is obsessive compulsive disorder, which is also more commonly known as OCD. I chose this disorder because many people claim to have OCD without truly understanding what it means to have obsessive compulsive disorder. In the United States, about 1 in every 40 adults have OCD. That's only 2.3% of the US population. With the percentage being as low as it is, OCD is still considered one of the top 10 most debilitating disorders a person can have. It's considered one of the most debilitating disorders because of how much it can affect a person. If a person doesn't complete these rituals, it can cause disruption to their entire life. They won't be able to work, they have trouble concentrating or succeeding in school. So OCD encompasses their entire life. The name obsessive compulsive disorder spells out exactly what the symptoms are for patients with OCD. They feel that they have to complete these things called rituals in order for them to function properly and not have this debilitating anxiety. So obsessive compulsive means that they fixate on something, such as touching a doorknob 5-6 times before they're able to move out of the door or turn the handle at all. If they don't complete this, then they suffer from extreme anxiety and they can't let it go. They are unable to move past that point in their day. These rituals and obsessions are reoccurring, so it can happen in more than just one place. It can happen, for example, the doorknob. That can happen not only when they're leaving their home, but if they're entering a store or if they're at work and trying to use the restroom. So it shows up throughout the day and manifests in different areas, not just one area of their life. One of the major characteristics of individuals suffering with obsessive compulsive disorder is that their brains don't produce the proper amount of serotonin. This is a factor that affects many people with many different mental disorders, such as depression or anxiety. Because of this similarity with different disorders, it can be very difficult and very time consuming for individuals suffering with OCD to get the proper diagnosis. On average, it can take up to 7 years for someone suffering with OCD to get the proper diagnosis, and it can take up to 17 years for them to receive sufficient care for them to be able to function seamlessly in their day-to-day life. There hasn't been an excessive amount of studies done with individuals suffering with obsessive compulsive disorder. However, the studies that have been done have shown that there are links between developmental relationships between parents and individuals with OCD. They found that it was more common for patients with OCD to have come from families where parents preferred the authoritarian type parenting style. So they believe that there is a link between how the child is raised, the home environment that the child has, to obsessive compulsive disorder. There are different types of treatments available for individuals suffering from OCD, such as medications. Many of them are also used for different types of mental disorders. So SSRIs can be used effectively over time to help patients get that serotonin that their brain isn't naturally developing for itself. They're also using ERP, which is exposure and response prevention. This exposure is supposed to help individuals learn to deal with that anxiety that can be caused from not completing their rituals. The theory is that the more they're exposed to this, the more that their body and their brains realize that it's okay for them to not complete these rituals obsessively. These cognitive therapies work by helping the individuals change the way that their brains are thinking and perceiving those feelings to help minimize that anxiety. I did come into this course with some rudimentary knowledge of some mental health issues. I didn't realize that there were so many. So the relationship that mental health has with patients and their healthcare providers is astonishing. And it's something that this course has really helped highlight to me and made me understand, which will make me more empathetic later on in my career as a healthcare professional, which is something that every healthcare professional needs to have, is that understanding of the way psychology works and the positive impacts that it can have, and how that knowledge can help you be a better healthcare provider for your patients.